Good evening and thank you for joining us. I'm Felicia Lawrence. Tonight, all Marion County hospitals now have visitor restrictions in place. The order coming from the Marion County Health Department just earlier this afternoon. In the last few weeks, we've seen flu cases skyrocket across the country. Tonight, we're talking about numbers that we haven't seen in a decade. So Lauren Kostick shares the urgent warning from doctors and also how you can protect yourself. Hey, Lauren.
Well, Felicia, doctors say it is typical to see a surge in sick people during the winter, but it's not common to see so many this early. And that is why they are worried tonight, urging everyone to get vaccinated.
Have you had any issues in the past with either shot?
As flu cases fill up emergency rooms,
1, 2, 3, little poke.
Vaccine clinics like this one are slammed.
Well, I'm diabetic, so I always like to have my flu shot, and I just want to make sure that I don't catch COVID again.
On Monday, hundreds showed up at the pop-up clinic at Martin University.
I just want to make sure that they're safe and healthy.
Leisha Bester brought her 5 kids, saying she's thankful none of them have gotten sick this season.
They've been healthy all year, thank God.
The free clinic comes as hospitals across Marion County enforce new visitor restrictions. Most recent data from Thanksgiving week shows area ERs reported more patients with flu-like symptoms than in the last 10 years. Statewide cases are high too. Take a look at this map. Indiana is a darker shade of blue, meaning the state has very high flu activity, with many of those cases being kids.
Felt like we were in a nightmare.
Brianna Lashley says her son Caden tested positive for influenza A and pneumonia almost 3 weeks ago. Since then, he's been at Riley Hospital undergoing treatment.
The first couple days, it was so rough. Like, it's the worst feeling in the world when you can't just do something to help your kid. Like, you've got to watch them just lay there and just fight through it.
She says it's scary because his symptoms started out like any other cold.
Caden was just fine Friday, had a cough, but it wasn't anything where I felt like I needed to take him in.
Next thing she knew, he was struggling to breathe.
A doctor came over to us and was like, we're going to have to sedate him. You know, his right lung is collapsed.
As viruses overwhelm hospitals,
we got the flu over here.
Doctors are also asking families to do their part, saying this flu wave could be just the start.
And if you are visiting a patient at a local hospital this week, here are the new rules. To start, they're not allowing any visitors with flu symptoms. Visitors must be immediate family, at least 18 years old, and wear a mask. Also, only 2 visitors are allowed per patient. So far, it's not clear how long these restrictions will last.
All right, Lauren Kostick, thank you so much. Tonight, an urgent call to federal health officials to help hospitals deal with the rise in respiratory illnesses. In this letter, the United States Health and Human Services Secretary tells governors around the country that the Biden administration stands ready to continue assisting you with resources, supplies, and personnel. Senate Majority Leader Chuck Schumer is pushing the federal government to step in and help.
I've known people whose babies, only a few months old, are spending more than a week in the hospital because the babies are suffering from collapsed lungs and needed oxygen assistance to breathe. Their parents keep vigil next to the hospital bed. They don't go to sleep because they're worried their child will stop breathing and they'll miss it.
As pediatric hospital beds are in short supply, well, so are pain meds like children's acetaminophen and ibuprofen. The near empty shelves have some patients worried, but pediatrician Dr. Eric Yancey says there's some other options.
There was one study a few years ago that looked at a little Vicks on the chest and a little bit of honey, a teaspoon of honey in children much older, like not under a couple of years of age, and that was as effective as the supposed cough preparations.
Dr. Yancey says never give a child adult medication. In fact, Yancey says he does not recommend a lot of the over-the-counter medication for children under the age of 4. Right now online, we've got more tips for parents. Plus, you can find all of the restrictions in place at Indiana hospitals because of this rise in flu cases. That's at WTHR.com.